I'm Dr. Ryan Stanton, and the doc is in. Let's talk a little bit about antibiotics, or actually the misuse of antibiotics. Antibiotics in medicine are one of the biggest and most misused items that we have. In fact, the CDC reports about 30 to 50% of the antibiotics that are used are completely unnecessary or unneeded. The use of antibiotics with viral syndromes are when we just don't know what's going on. The issue is really threefold. We're actually starting to produce significant multi-drug-resistant infections that are becoming harder and harder to treat. 2 are the side effects, including things such as C. diff that we're seeing more and more often, especially among the elderly population. And finally, we're losing efficacy for a lot of these antibiotics, having fewer and fewer options. Now, why is this the case? Why do we continue to overuse antibiotics? First of all, I think it's for patient satisfaction. Living in a patient satisfaction world, especially when it's a walk-in clinics and urgent treatments that are for-profit businesses, patient satisfaction is integral. And unfortunately, this means writing a script for antibiotics because it makes them happy. 2 is fear of litigation. That defensive medicine mindset, especially among children and the elderly, is something that drives a lot of treatments that may not be necessary. And 3rd, it's a safety net. It helps us sleep at night. Because we don't exactly know the answer and we're concerned there could be a bacterial infection sitting in there, a lot of times we will write antibiotics to help ourselves feel better that we may be protecting if there is a bacteria that's involved. The fact is, we cannot continue the way that we're using antibiotics, not just in medicine, but in the food service industry as well. Antibiotics are a key to help protecting us, but unfortunately, all we're doing right now with the way that we're using them is fast-tracking evolution and producing germs that we're having harder and harder times treating. So what can we do? We need to return to evidence-based medicine, making sure that we're doing everything we can to treat based on the evidence and risk for bacterial infection, not for satisfaction, not for fear of litigation, and not just to write a script to hand to somebody when they walk out the door. I'm Dr. Ryan Stanton, and the doctor is out.